Gout, also known as podagra, has long been recognized as one of the common inflammatory joint diseases, causing significant discomfort and greatly affecting quality of life. The root cause of this disease stems from elevated uric acid levels in the blood, which deposit as small, sharp crystals in the joints, triggering severe pain accompanied by swelling, redness, and warmth in the affected joint areas. Not only limited to acute pain attacks, gout can also lead to chronic complications, joint damage, and even affect kidney function if not properly managed. However, alongside using medication as prescribed by the doctor, an extremely important factor contributing to the successful control of gout is the daily diet. It can be said that adjusting and maintaining a scientific and reasonable menu not only helps control uric acid levels in the blood, but also helps reduce the frequency and severity of acute gout attacks. To achieve this, first, patients need to firmly grasp the core nutritional principles specific to themselves, thereby building a healthy lifestyle and proactively living in peace with this disease. So, what are the necessary principles in the diet for people with gout? First of all, it is important to understand that the main goal of the diet is not to completely eliminate purines from the meals. This is almost impossible, as purines naturally occur in many types of food. However, patients can actively reduce the amount of purines consumed, thereby lessening the metabolic burden of converting them into uric acid. The first principle is to minimize the consumption of foods high in purines. These are foods that, once ingested, are strongly metabolized into uric acid, contributing to an increased risk of gout attacks. Typical examples include red meat such as beef and lamb, animal organs like liver, kidneys, heart, and tongue, seafood such as sardines, herring, salmon, shrimp, ghee, crab, and scallops. Especially during acute gout phases, patients need to avoid these foods to prevent worsening their condition. Next, prioritize adding low-purine foods to your daily menu, especially plant-based protein sources such as beans, whole grains, green vegetables, and fruits. Vegetables and fruits not only provide vitamins and minerals, but are also rich sources of fiber, which help support the kidneys in excreting uric acid more effectively, while also contributing to alkalizing the urine, creating favorable conditions for the elimination of uric acid. An equally important principle is to drink enough water every day. Water acts as a catalyst, helping the kidneys work more effectively in eliminating excess uric acid. Patients should maintain drinking 2 to 2.5 liters of water daily, prioritizing plain water, fresh vegetable and fruit juices, or herbal teas such as green tea and artichoke tea. Avoid industrial soft drinks and carbonated beverages because they contain a lot of sugar and chemicals that are not good for people with gout. In addition, maintaining a reasonable weight also significantly contributes to disease control. Being overweight or obese causes the body to produce more uric acid and reduces the kidney's ability to eliminate it. However, patients should not lose weight too quickly or suddenly fast, as this can increase the risk of acute gout attacks. Instead, lose weight gradually by combining a proper diet with gentle exercise. It is impossible not to mention the role of limiting alcohol consumption. Alcohol, especially beer, has been proven to increase uric acid production and reduce the kidney's ability to excrete it. In addition, alcohol contains many empty calories, which can easily lead to weight gain, another risk factor for gout. Therefore, patients should avoid or minimize alcohol consumption and choose healthier beverages for themselves. Regarding food groups to avoid or limit, besides red meat, animal organs, and seafood, people with gout should also pay attention to reducing processed meats such as sausages, bacon, and ham, as they not only contain high purine levels, but are also rich in saturated fats, salt, and food additives, factors that are detrimental to bone and joint health, as well as cardiovascular health. Some vegetables like asparagus, mushrooms, spinach, and broccoli have relatively high purine content, but fortunately, purines from these plant sources have less impact compared to purines from animals, so patients can consume them in moderate amounts without needing to be overly restrictive. Be especially careful with drinks containing fructose sugar, such as soft drinks, packaged fruit juices, and various sweet candies. Fructose is a type of sugar that can stimulate the production of uric acid in the body. The habit of consuming a lot of sweet foods and candies can also easily lead to weight gain, obesity, and worsen the condition of gout. So, what are the golden foods for people with gout? First, whole grains such as brown rice, oats, and barley are indispensable. They are a good source of carbohydrates, rich in fiber, B vitamins, and minerals, helping to maintain energy without increasing uric acid. In addition, green vegetables and fresh fruits are optimal choices, not only helping to supplement vitamins and minerals, but also supporting detoxification and effectively reducing inflammation. Especially, berries like cherries, strawberries, and blueberries are recognized for their anti-inflammatory effects, helping to reduce the risk of acute gout flare-ups. Patients should also supplement with low-fat dairy products, such as fresh milk, yogurt, and cheese. Studies have shown that low-fat milk can help reduce uric acid levels in the blood and lower the risk of developing the disease. Plant-based proteins from beans such as soybeans, mung beans, red beans, and tofu are also excellent alternative protein sources to animal meat. Additionally, vegetable oils like olive oil, canola oil, and sunflower oil are not only good for the heart, but also do not increase uric acid. For poultry such as chicken and duck, the skin should be removed when eating and consumed in moderation. Some types of freshwater fish low in purines can be included in the diet 2-3 times a week, but in small amounts to avoid increasing the burden on the kidneys. To help patients easily visualize and apply, a sample daily menu can start with a light breakfast of toasted whole grain bread, served with boiled eggs and a glass of low-fat milk. Lunch may include brown rice, steamed fish with ginger, boiled greens, and a salad of fresh tomatoes and cucumbers. For dinner, a bowl of oatmeal porridge cooked with shredded chicken breast, added herbs, combined with a dessert of a plate of cherries would be an ideal choice. Throughout the day, instead of drinking carbonated soft drinks, choose water, green tea, or cucumber and celery juice to provide sufficient hydration and nutrients for the body. In addition, there are some important notes that people with gout should not overlook. First, it is essential to drink enough water daily to help the kidneys effectively eliminate uric acid. Second, control weight by losing weight gradually and steadily. Rapid weight loss methods or fasting should be avoided as they can lead to metabolic disorders and trigger gout attacks. Third, it is advisable to monitor and record daily meals to identify foods that may trigger pain, thereby allowing for adjustments suitable to one's own body. Finally, don't forget to consult a doctor or nutritionist before changing your diet or adding new foods. Eating scientifically and properly not only helps control gout effectively, but also improves the quality of life, bringing more resilient health and a more optimistic spirit every day. Overall, gout is not the end of a healthy and active life. If you proactively change your lifestyle, especially your diet, patients can completely control uric acid levels, reduce pain attacks, and prevent dangerous complications. Remember, a reasonable diet is not only an effective supportive treatment for gout, but also a solid foundation for a healthier and more fulfilling life. It is also a gentle yet profound reminder for each of us to listen to, love, and take better care of ourselves every day.